It's great, wonderful, and welcome news in light of what's going on in Rhode Island and throughout the country and throughout the world. There's a ray of hope now that we have a vaccine that appears to be, based on this early data, highly effective beyond the expectations of many. And if that's borne out with an appropriate safety profile, and manufacturing continues to be ramped up, it's just brought optimism to otherwise a scary situation. And I'm hopeful that it will be appropriately distributed to those most in need and have a real impact in mitigating risk and transmission.
What about the safety factor? Just speak to that generally.
Yeah, I think there's a lot of misinformation on the internet about vaccine safety, and the real scientific data that's in the peer-reviewed medical literature has found that vaccines are very safe, those that get through the FDA, and have a low side effect profile of significance besides arm soreness or maybe feeling a little crummy for a day depending on the vaccine. But is there a potential risk? There's always a potential risk for taking any medication, for example, or any vaccine, but that risk is extremely low if the data that we see with this vaccine is similar to other vaccines we use in the U.S. And I'd be first in line, if offered, to roll up my sleeve and get it done.
What would you say to the general public regarding this vaccine or vaccines?
I'd say that have trust in the FDA and the scientific advisory group, which is independent. I've done work with the FDA. You have to prove you have no financial ties to a particular product or technology. So you have this group of advisors to the FDA. They make a recommendation. Most of the time, the FDA heeds their recommendation and with regard to efficacy and safety. And I think we should welcome it with open arms. In terms of the anti-vaccine movement, if people don't want to get a vaccine, what I usually say is, that's fine. Just spend the rest of your life and your family in your house so you don't put us at risk and yourself at risk. So if you don't want to get a vaccine, you can either move to another country or live in your home so you don't expose the rest of us who have been vaccinated or those who may not yet be vaccinated and vulnerable.
This would seem to indicate there's light at the end of this very long and dark tunnel. Can you just briefly speak to that?
Sure. I think there's going to be, a trickle down with regards to, as people have heard about in the lay press and in the scientific literature, priority for vaccination. So it's going to be, healthcare workers, first responders, essential civil servants, people at the greatest risk otherwise in the community. So by the time it gets to the general average healthy person, it's going to be a while. But with each step along the way, we're going to reduce transmission, and we're going to have eventually what we call herd immunity, where with the vaccine, as well as people who have acquired the infection through transmission, we'll have enough individuals and communities immune so the virus is stymied. It's prevented from spreading from person to person, because it goes from one person, tries to get in the next person, they've been vaccinated or they've been previously infected. So there is light at the end of the tunnel. The tunnel's pretty long still before this and other vaccines are available for the common man and woman. But we're going to get there, and we'll get over this. I think, looking far down the road, it'll probably be something similar to influenza, where we'll have to be vaccinated every year or 2 years, whatever the case may be with regards to protective immunity. So I think, unfortunately, it's going to be with us for the foreseeable future, us, the human population. But now we have this very effective vaccine that will dramatically reduce risk. I mean, if that, the 90+% protective effect of the vaccine holds up with further study, as well as with other vaccines, it's spectacular news for all of us, for the human race.
In the meantime, as this starts to roll out, and certainly even before it rolls out, it's very important to continue wearing masks, following the rules that have been established for social distancing and crowd size. Maybe you can just sort of summarize that. This isn't like,
Sure.
okay, phew, we're done and, you know, magic bullet type thing.
Absolutely. So people may think, oh, I can be blasé-faire, let my guard down. There's a vaccine around the corner. I'll be protected. Well, that's not the case. It's going to be months and months before, you know, this is widely used in the general community. And you can get infected, get hospitalized, be in the ICU, be on a breathing machine, and not make it out of the hospital still until we have that vaccine and you get vaccinated and the vaccine has some durable immunity. So we've got to do everything possible. It is spreading so rapidly in our community and others around us. We've got to do everything possible to reduce transmission with regards to masking and social distancing, as the governor has and Dr. Alexander Scott have talked about, particularly of late with changes, and I'm sure there will be more coming. We need to, keep our guard up with Thanksgiving and other holidays. Sorry about the pager going off. It's going to be important that we don't have large family gatherings. It's going to be a sacrifice, but if there was ever a time in someone's life to do that, it's with these upcoming holidays. To distance, eat outside if you can, distance in terms of where people are eating and drinking, and otherwise to particularly people coming in from other areas of the state or out of state to mask to reduce risk. It's still as can cause as much harm to you as it could weeks ago, and so you can't let your guard down. The vaccine isn't around the corner; it's months away. You've got to keep up the fight for yourself and your loved ones and the rest of us.
Thanks, Len. Stay safe. We'll talk again soon.